American scientists, doctors, and businessmen have produced the most advanced medical technology in the world, American healthcare is in a state of crisis. Medical treatments are increasingly out of reach to many Americans because of the lack of health insurance. A feasible solution to the uninsured is to implement a universal healthcare program, which provides healthcare to all citizens. However, the United States is the only wealthy industrialized nation that does not have a universal healthcare program, because it will result in a government controlled, funded by taxes, as stated by Angel. A universal program would provide healthcare access to everyone regardless of age, pre-existing conditions, and income level. The disaster of Americans' healthcare is due from an outdated approach, which is not up to speed with the everyday growing economy. The private healthcare insurance process was an idea that worked in the past century. However, it will not be successful this day in society. For this reason, that jobs are ever more service-based, and risk pool made this insurance program no longer possible. As for the individual premiums, they average more than $4,000 per year, and a decent family's policy runs about $10,000 a year. Therefore, compared to minimum wage and the recession, you can see it's unaffordable. The obsolete method has left millions of Americans without coverage, and those who do not have coverage increasingly find that their plans are poor, which expose them to financial suffering or even bankruptcy when illnesses approach. Stated by Ronberg and McCain. America has the most expensive healthcare system in the world, which is not because we are sicker or more demanding, however, but the life expectancy rates are worse than more developed countries. In addition, healthcare is embedded not to the medical need, but the ability to pay. So, the process of payment for the solution starts by ending some of the Bush-era taxes, which are about $250,000 per year, which would amount to an estimate $65 billion per spent on healthcare. However, the opposing view in regards to funded taxes believes offering tax credits to buy healthcare. This coverage plan is set for individuals or families to buy their own healthcare or offset the taxes coverage through jobs by the way of credit tax. Universal healthcare is healthcare coverage which is extended to all eligible residents of a governmental region. Furthermore, insurance companies would provide coverage to all citizens regardless of pre-existing conditions such as diabetes or cancer. The insurance industry currently operates in a restricted manner when individuals with chronic or serious conditions are involved. They are rated in categories that increase their insurance premiums, or worse, do not provide access to essential treatment because they are considered a high risk. This obstacle would be eliminated with universal healthcare, because it would change many state laws which allow insurance companies to sell policies to individuals to reject those medical conditions, as stated by Appleby. In America, many people are aware of the Medicare system, which is a government-financed single-payer system, and which is the most efficient part of America's healthcare system, which universal coverage is trying to simply extend. In 2006, Massachusetts is the first state that has taken an incentive by acquiring a universal approach, which is to cover most of the uninsured by requiring everyone to have coverage and subsidizing care for the lower income residents. The Massachusetts policy helped increase enrollment in health insurance by more than $300,000, which brought more people to qualify for subsidies to help buy coverage. In conclusion, all Americans should have health care coverage, and certain financial obstructions should not prevent us from accessing health care when we need it the most. Clearly, the private health care insurance system cannot meet Americans' needs, and has become too costly to be financed through private insurance premiums. Furthermore, Americans are the only developed nation that does not provide inclusive health care to all citizens. There's an estimated 47 million uninsured Americans who need health care as equal as anyone in our country. America has an equal rights policy, so health care should be a basic human right, not a privilege.